Just on the roadmap, it really is our pathway out of here. Clearly, it's got some indicative signposts on the way. I think they provide hope. It is a long path still, but it is absolutely right to consider it our home stretch. We would all like to already be at the settings that might apply for Christmas, to see our friends and family overseas, to be able to gather in large groups. But there's a long haul in front of us, and there is a lot of work that we still need to do collectively to make sure that we protect ourselves, protect each other through that pathway. It remains a tightrope between ensuring that our health system is not overwhelmed, but also being able to sustain us in our well-being and to protect us from those other harms that come from lockdown. That is no easy pathway to take, but it is based on the best of modelling that we've received and the best evidence that we've got available to us. We will continue to review the epidemiology day by day to see what adjustments can be made in that roadmap. We might do better in some areas. We might need to hold in others. We'll make those decisions at those junctures as public health directions are getting written down. But we should feel hopeful about some of the really important changes that will come in coming days. People might rightly ask, why are we opening up anything before 80% double dose? Well, there is an issue of our well-being, and I've been asked many times on it, and we all need to reflect on that. There are challenges every step of the way in lockdown, and we need to bear in mind how people sustain the behaviours that need to be sustained, how people are challenged by their social isolation and by not doing those things that they love, and we need to be able to support people on that slow and steady pathway to opening up. That does mean that for those lowest risk activities, we should make those available to people to support their well-being, and also to ensure that they are focusing their attention and their behaviours in those areas that are lowest risk. So those interactions with other people happening outdoors, happening amongst fully vaccinated individuals, and happening with the lowest risk of transmission to others. That gets people out of not complying with the really important bits about not seeing people within homes, not interacting in a way that really drives the numbers in this epidemic. We are in a once-in-a-century public health crisis, so there is no easy pathway here. I've said it all along. There are only difficult choices to make, but I think the roadmap provides for that awful but balanced tightrope between really difficult positions. But we should feel hopeful about the things that are coming in weeks and months ahead. Some other changes just on New South Wales. There will be some changes to our border settings from 11:59 p.m. tonight. The 66 local government areas plus Jervis Bay, which are not locked down currently in New South Wales, will be downgraded from extreme risk zones to red zones. That means that Victorian residents have an entitlement to apply for a red zone permit and an entitlement to return to Victoria. They'll have to quarantine at home for 14 days and get tested at regular intervals through that 14-day period. But you can't have been in one of those remaining extreme risk zones, so those LGAs under lockdown in New South Wales in the previous 14 days before you travel. It'll also have impacts on the New South Wales-Victoria border. Before this outbreak in New South Wales, people living in the border community could cross the border for any reason without a permit. That changed when the entirety of New South Wales became an extreme risk zone, and people in the border community had to obtain a cross-border community extreme risk zone permit to cross back and forth. Now, for all but one cross-border local government area, which will be they'll be downgraded from an extreme risk zone to a red zone. That's all of the cross-border area apart from Albury, which is, of course, in lockdown at the moment. So if you live in that cross-border area, and if you haven't left in the previous 14 days or been in Albury in the previous 14 days, then you can enter Victoria without a permit for any reason from tomorrow. The usual disclaimers stand. You can't have COVID, you can't be a primary close contact, you can't have symptoms, and you can't have been to an exposure site. If that applies, you really shouldn't be travelling at all. You should be in quarantine or should be getting tested and isolating until you have your result.